Thank you very much, Minister. We have got a few minutes for questions. I'm getting nods from over there. Could I invite, Minister, could I invite you to Mrs. Kiro to come back up to the front? If you could indicate if you want to ask a question, there are roving microphones, at least there is on that side. And please, when you ask a question, if you could introduce yourself, give your name and your organisation, and please wait until you've got the microphone. So there's a question down here.
Kia ora, I'm Marilyn Head from the New Zealand Nurses Organisation. I was interested to hear that you were interested in free trade agreements and how that can affect public health. And I just wondered also in terms of equity and poverty and control, etc., how much the Trans-Pacific Partnership Agreement is a concern to you, and also perhaps to Cindy, if she has thought about that, the effect, the public health implications on the Trans-Pacific Partnership Agreement, which will really are fairly extensive in terms of extending patents and limiting the control that New Zealanders have over the decisions that they can make about public health. So it's not an elegant question, but I just wanted to get that in.
The trade agreement. That's a big topic and it's a mouthful. A lot of issues involved. It contradicts a lot of endeavors that the health has been trying for years to achieve, including our own country in Samoa. We, for example, we were successful in campaigning and influencing parliamentary political decision on to ban turkey tails. It was with the intention also of banning fatty mutton flaps from New Zealand. For you to know that. We didn't get that far because the WTO accession came earlier, which reversed those decisions made for the health of our people. But we still have the right to impose restrictions in order to make sure that our people will not indulge to the point of threatening their own health. That is, up to December this year, in December this year, the importation of turkey tails will be allowed to conform to WTO agreements, but it will not be for sale in shops. It will only be for personal consumption. But the tax will be 300% on the turkey tail, and it's only for personal use. Well, that's part of involvements. The other threat by WTO is, I think we stand now maybe to lose more personnel from Samoa, going to work on other countries. A lot of people in Samoa wanting to leave, because of pay issues and things like that. So now I think this will open the door for them also to facilitate the ease with which they can live and find jobs as well.
Okay, time for one last question, gentlemen at the back.
Presentation. My name is Ale Pepe, Anthony Del Pepe from the organization called the Almanga South Pacific Trust. My question to the Minister, 1 in 2 Pacific Island people in New Zealand are Samoan. Is there an opportunity for the Samoan government and also the Ministry of Health to share some of the knowledge that you have and what it works in our Samoan community and come and train some of the people that works for our Pacific services in New Zealand, how to approach our Pacific people, especially our Samoan community, because most of our Pacific people as well work for Pacific service but have got no idea how to work with our Pacific people as well. That's the question. It would be nice to see it happen.
The question is, can some people from Samoa come and train you here? I just wish to point out that every year, 1,200 people migrate to Samoans, migrate to New Zealand under the agreement, the Treaty of Friendship with New Zealand. Among those people would be a lot of them that can teach. The thing is, I think for the other issue also, I'm trying to explain that it's not necessary to do that because our people also are very much in link with their families at home. They only need to come and see and maybe to revitalize the Samoan way of connection and caring, and but yes, of course, our people at home are seeking opportunities like that to come over. So why don't you write me a letter and ask, and I will surely appoint some of my staff here, some of them are here, to come over and do that for you here. But I believe the expertise, I heard the presentation this morning by the associate professor, and that was really remarkable. It reiterates what we heard last night as well from the Commissioner of Health. The thing is, we really have to look deep what is relevant in our own immediate environment and the culture that we live in. We have to conform to the culture and the people that we are living with in order to have harmony and also ways to reach the political decisions that will make the difference in terms of resourcing and financing your needs.
Okay, thank you very much. I'm just going to make some closing remarks, and then I think there's going to be a little bit of a musical interlude, and then Warren Lindbergh the Chief Executive of the PHA, will come up and close the session. But just to express my thanks, and I'm sure your thanks, to both the speakers today for such excellent presentations. I think the words that you finished with, Minister, about being bothered about the statistics that have been presented, I think that's a very appropriate way to feel, to be bothered and upset and angry about child health and child health inequities. But of course the point of this conference is to channel some of that anger and being bothered into action and solutions, and I'm sure that's what we'll be doing and thinking about for the rest of the time. But if I could just, on behalf of the conference, present a small gift to our two excellent presenters today, and if we could thank them in the usual way.
Honourable Minister Talofa, on behalf of the Public Health Association of New Zealand, I'd like to add our appreciation for your presence at this conference, for the pleasure we've had in sharing time with you and your delegation, and for acquiring some insights into the health issues we share, especially for Samoan people in both Samoa and Aotearoa, New Zealand. In particular, I want to thank you for your kind invitation to the Public Health Association of New Zealand for some of our members to observe the important meeting of Pacific leaders in Samoa next year. We are honoured by your invitation and will consider how we can best respond to that opportunity to strengthen the relationship between the descendants of Tuperata and Maui with the wider Pacific community. Whawhitai.
Talofa lava, my name is Petelo Laupepe. I'm a piano player. Today I'll be playing for you Party Rock Anthem. If you feel like it, you can get up and dance. Yeah. Enjoy.